Live. Hold on one second, folks. We'll let some folks join in here. We're just confirming that we're all good. Alrighty, we are live. Loading now. We are loading now.
Okay, good.
Alrighty, for those of you just joining live here, Lewis here, Status Coup. We're in East Palestine. We've been here for a couple days so far. For those of you just joining, hit the like button to help get the stream out to more folks. We'll let the audience build up a little bit here. I'll talk a little bit just to give you an idea where we're at. We are currently at the clinic that's been set up by the state of Ohio. We're going to get into the actual resources that are being provided here, and also, more importantly, the resources that are not being provided here at this center, again, set up by the state of Ohio. Again, if you're just joining us, folks are probably just streaming in right now. Hit the like button to help get this out to more folks. Again, we're here right at the health clinic here, set up by the state of Ohio, right here in downtown East Palestine. We've been talking to folks literally all day for 2 days straight. My phone has been ringing off the hook. John and I have been communicating with residents who are experiencing all sorts of just terrible health effects from all of this going on. People concerned about the water, rightfully. People concerned about air quality, rightfully. Last night, you probably saw the live stream with Jenna and several of her neighbors with train tracks right in her backyard. Trains were ripping by throughout the interview. The air was getting, all sorts of stuff being kicked up into the air. Several of those people dealing with issues with their eyes, sore throats, getting inhalers and things like this for issues they've never had before this actually happening. But what we're going to actually start off with today, if you did not see the clip already on our Twitter as well as on YouTube, this morning I was tipped off by local residents last night that we actually had on the live stream. Major credit to Jenna Catone, a resident here, who is really trying to keep this in the forefront. We got a phone call from her this morning saying Governor DeWine was on her street. John and I were fortunately only 4 blocks away or so, made a quick turnaround, headed right over there, went up and approached him, and there were several other journalists already there. Nobody thought to ask the governor a single question while we were there. Unfortunately for Governor DeWine, and fortunately for you all, I decided to ask him a couple questions, considering I was on that street, the exact same street he was on the night before, talking to residents who were frankly pissed off at the results that the state of Ohio, the federal government, anybody has essentially provided them so far. So I asked the governor a couple tough questions. It seems like he is not used to getting some of those tough questions because he was very eager to leave. I got him to stick around for a little bit. If you haven't seen that clip yet, after this is done, definitely go watch it. It'll be very easy to find on Twitter. Same goes, it'll be right here on our YouTube channel as well. During that interview, he talked to me for probably 3 minutes or so, one-on-one. He lied to me at least once, and we had the video to play right away afterwards to prove it. He said, and on top of the lies that he was providing there, he was also saying, we've been testing throughout. I pointed out that many of the tests to at least get this whole thing started were being provided by a contractor hired by Norfolk Southern. Yes, the Norfolk Southern that caused all of these problems in the first place. And then we wonder why all of these folks that I've been talking to the last 2 days are not believing the tests that they're, being told are fine. They're very much concerned about the health of themselves, their children, their neighbors. It's issues like this where, no journalists and a lot of other people are not asking tough questions of these people in power. The governor today, this trip was definitely not something that was open to the media. It wasn't a press release or something, or a press event or anything like this. The only way we were able to go in and actually ask these questions was because of this resident tipping us off to it. These other folks who were with them were probably on some sort of curated list. They got a special message from the governor's office. They know they're going to go and get their special little photo op. Governor's sitting there talking with residents. And while he was actually in this neighborhood, he had the gall to, go and say he's so sorry and then literally give out cookbooks. he gave out cookbooks to the residents. If you're not following me on Twitter, I posted a photo of it earlier at LewisD217. You can check it out. A cookbook with a little cookie. So sorry that this massive disaster happened literally in your backyard, because these folks literally live on the train tracks. But here's a cookbook with a cookie. Enjoy. The residents that I talked to, again, I got several messages about this. They're pissed. They're pissed off. Imagine having a toxic chemical spill and then be set on fire basically in your backyard and be rewarded with a cookie. I don't even know what else to say about that. It's absolutely insane. I'm going to take one step forward here. Again, if you're just joining us, definitely smash the like button here. Help get this stream out there. Share it on Twitter or wherever you post your social media the most. I rhymed there and didn't even try. There we go. Also notable during the DeWine interview was when I brought up that a lot of these residents that I've been talking to were having health effects. He pointed them to come here to this clinic set up by the state of Ohio. As soon as I heard about this clinic, I started checking through my messages again. I've got lots of East Palestine residents sending me updates and tips from all sorts of different things. And if you're watching from East Palestine, thank you, because we're trying to get all of this out here. What is being... What was that?
People live here and want to go in, and you're taking up all the spaces out front. Like, there are elderly people who would like to park.
Gotcha. We can scoot over.
When they come over, we'll move on.
Yeah. Got it.
You didn't ask.
Okay. Gotcha. We're gonna just take a quick move over here. Bear with us for 1 second.
You guys want to set up the staging area over here? We can set it for you.
Gotcha. There were a bunch of folks set up there before. Is the only reason we didn't. We're happy to move over though. Sorry about that, guys. Yep. No worries. Alrighty, so and folks, if you're still watching, definitely. So what is currently being provided here at the health clinic? So already, are we all? Okay, we're.
Just so you know, I believe Friday hours are shorter to the we're back, right? Okay, we're good.
We're good. So John, we're actually live again? Alrighty. Sorry for the brief interruption there, folks. I don't know exactly where we cut out, so I'm just going to read the list of what is being provided here for residents again, just in case we missed that piece of information. I'll pull it up again here. So again, what you will find when you're here at this center here, according to the document that has been put out by the for the health assessment clinic, speak to a registered nurse or toxicologist, referrals if needed, mental health professionals on site, and an assessment to help officials understand the health needs of community members. Again, more notably, what is not being provided: prescriptions, any vital sign monitoring, diagnosis of any kind of your, what your symptoms are saying, or any type of blood or urine testing. So residents I've spoken to, some of which you've seen interviews posted already, some of which will be posted over the coming days, including Candace and Jenna and several other folks, sent me this and were frankly upset. A lot of these folks are having trouble getting, appointments to doctors. If they need to make an ER visit, oftentimes that's very expensive. So the governor is telling them, if they're having these symptoms and whatnot, come to the clinic. And when they get here to the clinic, they're essentially told to go see their regular doctor or go to the emergency room. So many of the folks that I've talked to over the last couple of days are not exactly happy with that. And that answer earlier when I talked with the governor was frankly a non-answer. And as we heard in his answers, he was kind of rambling around to all sorts of different things. I interrupted him to ask another real question so that he wasn't going to just try to waste time. And that's when he spit out the lie, which you can go and watch the video to see after the live stream. Again, it's on the YouTube as well as on Twitter. So with that, we also yesterday spoke with a resident named Ashley. We're going to be posting interviews with Ashley from yesterday. She is another local community member who is out here working her hardest to try to keep this in the limelight. She knows inevitably folks around town and all the media hype that's going on right now is going to be gone. We're going to continue to come back to East Palestine for years, just like we did with Flint, Michigan, just like we will continue to do in Jackson, Mississippi. These stories are great and sensational right now, and there's a lot of attention. There's a lot of characters coming into town this week, including President Trump tomorrow. So there's a lot of folks rolling into town right now for that. But this sort of stuff, these stories, we're not going to find out nearly half as what we need to right now. This is something that we're going to need to come back 4, 5, 6 times and more into the future, and we're only going to be able to do that by our member support from folks like you. It's tough. This is expensive stuff to do. John and I are going to be out here all week. I wish we could do it for free. Unfortunately, we can't. We got to pay our bills just like you do. So we're going to be needing to, increase our membership to make a lot of this happen. So for $5 to $10 a month, you can become a member. StatusCoup.com/join. This stuff's tough to pull off, and the amount of stories that we are getting, and I'm going to get into a couple of them right now, are absolutely insane. So first off, Ashley, that I started to mention yesterday, she started posting in Facebook groups to try to get some folks together and created these bright orange flyers. And these orange flyers, and I want to pull up the name of it just so that I can get it perfect for you here. So these flyers say, hazardous chemicals inside. Thank you, Norfolk Southern, with a hashtag EP Strong on the bottom. And she's been posting these in Facebook groups. You're not going to be able to get the whole thing. That's okay. We'll make sure this is posted. And so she's been posting this in local Facebook groups and going door to door around town and knocking on the door of residents and then asking them if they'd like to hang the sign up on their own, so that when all these folks are coming into town, I mentioned President Trump, now FEMA and the EPA are rolling into town and this sort of thing. Well, EPA's been here, but FEMA's starting to roll into town now. They'll have this on their door. What is pretty interesting is while we were out walking door to door with Ashley yesterday, we first had a pretty interesting experience with a car pulling up to us with someone wearing an orange vest inside, likely a railroad employee, and started recording us and Ashley going door to door, knocking on doors with these orange flyers. We kind of turned around and we were wondering why this person was right behind us and noticed they were filming us. As soon as John turned the camera around, the person in the car put their hand up to try to block the camera and sped off. That was really interesting, and Ashley told us that that wasn't the first time that this had happened to her. And it gets even crazier is when this morning we actually get a text message from Ashley with a news article. I want to read it here, just the headline. This is from WKBN. The headline is, Norfolk warns of, quote, fake orange flyers in East Palestine. Fake orange flyers in East Palestine. Norfolk, I'm going to read it again. Norfolk Southern warns of fake orange flyers in East Palestine. Now, that's basically taking, probably the narrative from Norfolk Southern and making it the headline. They did talk to Ashley later on in the interview, but there's nothing fake about the flyers. Norfolk Southern further on in the article said, Norfolk Southern saying these articles are fake and they can, quote, cause confusion amongst residents. You know what I think probably causes more confusion amongst residents is Norfolk Southern providing testing that says, one thing one day, then the EPA saying another thing, and residents being told that it's safe to be here, and then, oh, well, now we're all getting rashes. Is it still safe to be here? The answer is probably no in a lot of cases, that it isn't safe to be, using the water, being exposed to this for weeks and weeks at a time, right? Instead, Norfolk Southern is, they're worried about causing confusion amongst this. These people have been given so much information in so many different places that changes so often. Orange flyers on your door is not misinformation. And she is also not claiming to be Norfolk Southern on these flyers. She is just having folks put these in their windows, essentially, as a sign of solidarity, to share what's actually, you know, what people's thoughts are and reactions are to all of this going on in town. It's a little bit ridiculous. Folks, if you're still watching, definitely smash the like button. I'm going to start to talk a little bit more about all of the different residents we've been talking to, as well as a bunch of just anecdotes that John and I have had reporting here over the last couple days. Again, we're going to be here for a whole lot more than that, so please smash the like button. Super chats are absolutely welcome. I'm going to take a quick sip of water here. So we have some new YouTube subscribers. Okay, there we go. So we got up over 600 new YouTube subscribers in the last couple days since we've been here. Pardon me for 1 second while I take a sip of water, and there's going to be plenty of great stuff on the other side. I'm going to take a breath and take a sip of water. Alrighty. I don't know how Jordan can just do it for 20, 30 minutes. He's an expert. I got to take a breath every once in a while. I'm getting worked up over here. Alrighty. So one interview yesterday that really, like, it was a hard one to do. I mentioned her name a couple times in this stream. She's got a little boy and a couple younger, even younger than this boy as well, children as well. I was speaking with her, and she's starting to tear up talking about her little babies breaking out in rashes, having a hard time breathing, and she is just absolutely frustrated, as many of the other folks that we've been talking to are, at the lack of understanding and resources that are being provided. These folks are having to go, if they want assistance checks or anything like that, they're having to go stand in long lines at the Norfolk Southern Assistance Center. We've been talking to people in line there who are having to jump through all sorts of hoops. They're being told that they need certain documents ahead of time, and then that when they arrive, they need an additional document that they were missing, so they get sent home. They're running out of certain numbers of tickets at the door. So Candace is sharing frustrations like that, frustrations like this, where, you know, okay, great, the state is setting up a clinic, but this clinic, again, isn't actually providing medical attention, really. They're providing advice, resources, people to talk to, which is tough to be able to do and to deal with. Give me 1 second. Well, yeah, and then on top of that, additional folks we're talking to beyond Candace include Jamie. Jamie used to have a house right along the water, right along, I believe it's called Sulfur Run in downtown East Palestine. Along Sulfur Run, that is where we are seeing the videos of many people throwing rocks into the water and seeing chemical and whatnot starting to pop up from underneath the water. This is both above and below the kind of mini dam system that is set up with the pumps and all sorts of things pushing water around and not really seeming to clean it at all in any real way. We've got her house right along Sulfur Run, and she claims that Norfolk Southern said that her house was deemed too toxic to return to. Again, she has little kids. They are fortunately able to stay with family and friends who are further away over in like the northern West Virginia, which isn't too far of a drive, at least. She is dealing with all sorts of issues here. She's got family members who are not feeling well, including her mother, who we spoke with this morning. Her mother's name is Stella. We interviewed her as well as her husband, this is a tough interview that we're probably going to be premiering tomorrow, and they shared with us all sorts of concerns, including initially when this happened, Stella's husband, Darren, he keeps rabbits, and he's really concerned about the rabbits. He actually does it as like a kind of a farming investment. The family will eat them and whatnot. They spent a long time kind of building this up, spent a lot of money and time and effort, and they're concerned about the food there. They also have some land behind their home. They're concerned about the creeks and whatnot behind their house. They're foster parents and have several children who they're afraid to let play in their own backyard because of the dust and the chemicals and all the stuff that was essentially set on fire. These folks all live within roughly a half a mile to a mile radius of East Palestine. It's just really hard to listen to some of these conversations. At one point in the interview, again, make sure if you're not subscribed already, subscribe so that tomorrow you can see this when it premieres. If it'll either premiere tonight or tomorrow. At one point, Darren tears up and walks away from the interview for a bit because it's hard to talk about. I mean, these folks have kids and foster kids who are getting sick as a result of this. A lot of folks don't have the money to just pick up and leave. They need to work. They have roots here. They can't say, if they own a house, they can't sell it. Who the heck's going to buy a house here? Several homeowners, the homes have been in their family for generations. The house we were in today with Stella, they've owned that house for 100 years. Okay, sure, you can pass the house along to your children, but what is the house going to be worth anymore? Is Norfolk Southern going to be responsible for any of that? The reality is likely no, they're not. Hopefully that's not the case. Hopefully people actually keep pushing on this and they can make something like that happen. But to be honest, I don't know. I mean, fortunately, many of the residents here are really pushing and pushing and pushing to make this sort of stuff happen. Again, this sort of stuff is really tough to actually come out and do. This is not a one-trip thing for us, right? We're going to be back in East Palestine several times after this. This is going to be something like along the lines of the coverage we've done of Flint, Michigan over the last 8 years. Jordan has been going back time and time again to Flint. Frankly, I mean, this is it's looking like it's gonna be my Flint here. All right, so if you guys want updates on this and we want actual reporting, we've got several things that we're looking to potentially break here in the next couple days. We've got lots of questions about the air quality testing. We've got lots of paperwork from several households of their actual test results, as well as the companies that are being used to do them, and lots of extremely shady ties of the companies that are being hired to do these air tests. We're getting that paperwork because we're putting the time in to do it right now. The only way we're going to be able to break more stories like this is by support from folks like you, to be able to get folks like John and I out here to actually report on this stuff and talk to the residents who are having to deal with this shit every single day. This is not a joke. These people's lives are being upended, and no one is taking care of them for the most part because of a freaking billion-dollar corporation that can absolutely afford to make these people whole. These people, in many cases, especially the ones living right around the railroad tracks, should very well likely not be living in their homes right now. They definitely should not be drinking the water. I don't know, just this is anecdotally from me looking at the stuff, smelling the stuff, seeing what's in the air, seeing, smelling the water, seeing that people are getting rashes after taking showers. I'm not the EPA, right? Don't get that advice from me necessarily, but something seems clearly wrong. So if you want folks to actually go and uncover this sort of stuff, please consider supporting us to continue this reporting. We are making tons of contacts on the ground here. My phone is literally blowing up as I'm on this with people messaging me about different things going on. I can almost guarantee it. Let's confirm. It is. We have another message from Candace. So please consider supporting us. StatusCoup.com/join. It's literally $5 to $10 a month, guys. That's like one trip to Starbucks, which you shouldn't be going there anyway. But that's one trip to Starbucks, right? That's a gallon and a half of gas. If you can make that happen, we can continue to bring this sort of reporting to us. If you also want to make a one-time donation, StatusCoup.com/donate is the place that you can do that. This sort of stuff is tough to do. And frankly, again, we've only been here for 2 days. And I feel for these people. It's tough. I mean, watching mothers have to talk about being worried about, is their kid gonna be okay because they're labored breathing all night, and the kid's needing to go to the hospital and having nebulizer treatment, and that kid's had no issues before. That's not a coincidence. It's just not a coincidence that stuff is happening, and that's happening here right now. And the more people that I talk to, the more and more that I hear it. So again, if you're able to make this sort of stuff happen, StatusCoup.com/join. That's the way to do it. Again, Super Chat's super welcome. I also want to be able to try to answer some folks' questions. And John, are you able to pull up the YouTube comments potentially? If you have questions on stuff, I want to take some time to actually do this. Again, we're going to have tons of content coming out on the YouTube channel the next couple days. I just wanted to come give you this update live of what we're actually finding. While John pulls up the YouTube comments, I'm actually going to, I'll give you a couple more anecdotes of little things that we're kind of finding. I mean, last night while we were reporting along the railroad tracks with Jenna and several of her neighbors, as the trains were going by, the dust was kicking up in the air, and it was noticeably you could smell it in the air, and things were not good. I went into a gas station earlier today, right along the railroad tracks here, and the inside of the gas station still just smells like, it smells, I've never smelled a gas station that smells like it. It's a weird thing to say. A lot of gas stations smell bad. This smelled bad not in the normal bad gas station way. This smelled bad in a weird, hazy, smoky, chemical-y way. It was bizarre. I walked out and I immediately said to John, I was like, that did not seem right in there. Smoky, made my eyes feel a little bit weird. I know John even has also said his throat a little bit. In hindsight, last night I probably would have put my respirator on. Jordan has been pushing us to wear them. I feel comfortable in most of town being without it, but if we're going near the railroad tracks again like that, we'll definitely be wearing them in the future. Again, Jordan and the Status Coup folks are making sure that we have all the equipment that we need if we want to be able to go do that. Do we have some comments potentially coming in here, or even some super chats potentially? We can potentially read them. Let's see. Colin may even have sent an email already with some super chats. We're going to pull this up again. If you give us 1 second here, we'll try to pull some up here. We do already. Perfect. Thank you, Colin. So we've got a new member to thank. First off, Christina Mandel, new member. Thank you for joining. We appreciate it. Again, new membership is how we're able to continue to make this sort of stuff happen. Carrie Nanstedt, $20. Good job with a heart. Thank you so much, Carrie. Again, support from folks like you is exactly how we're going to be able to make this happen, to continue to bring the stories of folks like Candace, like Jenna, and all these other folks like Stella, like Darren, and I mean you're gonna see tons of interviews being posted over the next couple of days. So that's how we're able to do it. Das Bosch Fleisch, probably butchered that one. I think that's $5.99 in euros. So. Thank you very much. Apparently, the designated media area is equipped with a signal jammer. Smiley face. Ha ha ha. Yeah, who knows? I think we might have just had a little unplugged thing. We'll go with the signal jammer thing. Yeah, that's what it was. That's what it was. Thank you very much. Tony D, $2. Thank you, Tony. Protect yourself, Lewis. Keep it up. Thank you, Tony. We appreciate it. And yeah, thanks for that. We also have $5 from Melina Tivis. Thank you very much. Another new Status Coup member, Ken, new Status Coup member. Thanks for joining. We appreciate it. Again, if you're able to be able to become a member, it's literally $5 to $10 a month. That's it. Pretty simple, pretty easy. $5 to $10 a month. The cost of a cup of coffee, basically. If you're not able to get do that, make sure you subscribe to the YouTube at least, and we're going to be posting a bunch of other contents there. Another $20 here from Humorous. I agree with Jordan Sheridan. Everyone needs to support the truth. Why even bother to listen to corporate media? Fox and MSNBC are the same. One proposes lies and propaganda. The other omits the truth and covers everything up. Very well put, Humorous. And I believe I just got another thing sent in here. These are some questions from Jordan here. Let's see. One for those that came to the stream late. Can you? Okay, these are. He's LOLing at me as this doing this. So I'm gonna go over the. What about my super chat, Jordan? I didn't see your super chat actually. Colin didn't send it, so that's on Colin, not on me. But here's. I'm gonna do a brief recap here of we're in front of the clinic that this morning when I talked to Governor DeWine. He was not very excited to talk to me. You'll have to go watch that clip. It's on the YouTube channel after this. But the clinic here, and let me just pull up. I want to make sure I can give you exactly what this clinic is offering, and more importantly, exactly what this clinic is not offering. So what can you get inside of this clinic that Governor DeWine told me that residents should go to if they're experiencing the symptoms that the people that I'm talking to are experiencing? You can expect to get speaking to a registered nurse or toxicologist. So you can speak to a registered nurse or toxicologist, referrals if needed, a mental health professional on site, or an assessment to help officials understand the health needs of community members. More notably, what will not be provided at the clinic is prescriptions, vital sign monitoring, diagnosis of any kind, and blood or urine testing. Again, people that I'm talking to are not happy about this. This has been sent to me by several residents, and they highlighted the section that says what will not be provided because they're worried about if they need to go have an ER visit. Many of them have to pay out of pocket for at least a portion of the ER visit, if they've got insurance, it might cover part of it, but most people's insurance, if you have an ER visit, you've got a deductible out of your pocket. It might be $1,000, it might be $5,000. That's not feasible for all of these people to be able to do, especially for having to go to the ER in the first place for something that has nothing to do with anything that they did, but has everything to do with what Norfolk Southern, the billion-dollar company who is ruining this town, did. So that's what's going on at this clinic here. We're gonna have some more interviews with actual residents talking about all of this for you probably tomorrow. Again, that's another excuse to be subscribed to the YouTube channel so that you can see all that sort of stuff as it comes out. I will also talk again about the confrontation with the governor this morning. This morning, when we got a message from a resident who lived on the street that the governor happened to be on, there were several other journalists there. They were kind of walking around taking photos of the governor. When the governor was walking down the street, they kind of packed up their bags, basically, and seemingly were getting ready to leave. No one was asking him a single question at all. So, John and I hurried over there, and we talked to him for probably 3 or 4 minutes before he didn't want to answer any of my questions anymore. He tried to leave in the middle of it at one point. You can see him actually kind of like look over towards one of his aides or something like that and like motion that he wanted to leave, and I got him in with one more question, which he flat out lied to me with the answer. We have the video to prove it, so again, go watch that after this. It was an exciting moment, to be honest. We got the message that he was right there, and I was like, John, I think we're like real close to this. And we drove over there real quick and got the question out, and afterwards I was like, oh my God, like we got him. So definitely go watch that. Proud of that moment. And yeah, I mean, unfortunately, none of the other journalists were going to ask him anything. Like not even a fluff question. Not even a fluff question. I'm not afraid to go in there and ask him what the actual people who live in this town want to ask him. And when that clip got around to all the people I'm talking about, they were all like, thank you for making him squirm like that. Although Jenna told me that she thinks one of her neighbors down the street, this happened before we got there, she thinks one of her neighbors down the street got him worse than I did. So I wish we had that on video too, because that would almost be more impactful. So at least he did get an earful from more folks than just me. But we were able to give it to him again and then have that one be on camera. So shame on those other folks, though, for not asking the man a single question. I'm sure, though, that it was like they sent a curated group of contacts who they knew were going to treat him well and not, respect everything that he, we don't want to take any questions. And they were just going to show up and take a photo of the governor handing out his wife's cookbook and a cookie to residents. Let me say that again. The folks who live with the train tracks in their backyard, the governor was on their street today saying, I'm sorry, giving them a cookbook with a cookie and saying that if they're not feeling well to come to the clinic, that doesn't provide like any actual, treatment or medical service. You can talk to folks in here, and I'm sure they're referring you to the right place, but that doesn't change the problem of if these people need to go to an ER to their doctor, they're likely going to have to pay for at least a chunk of it, and a lot of these folks might not have the money to do so. But enjoy your cookie and use my wife's cookbook, but maybe don't use the water? ? I don't know. Yeah, ridiculous. And then we've got another one here. Can you describe some of the health symptoms residents have been describing to you and that they and their children are having? So with that, I mean, it's all sorts of things, right? A lot of it starts with, nose, the dry nose, stiffy nose, a stuffy nose. We had residents earlier today say that he was essentially like having almost the equivalent of having hot peppers, and you rub your nose after you cut hot peppers. He said he kind of feels like that quite a ways. That was Darren that we talked to earlier today. Again, that interview will premiere tomorrow at some point, or potentially tonight, but keep an eye out. Again, a reason to be subscribed. Folks just getting rashes on their body. We think that it's probably from, showering and things like this. So rashes are definitely common. Headaches are definitely common. Dry eyes and kind of like eyes burning are definitely symptoms that we're hearing from folks, as well as some of the worst ones. I mean, we're hearing about folks with diarrhea. We're hearing a lot of, Stella was saying that her kids and I think another person mentioned this to me as well, bloody noses being very, very frequent in people who are not frequently getting them. So that's another major concern and health effect that residents are seeing. Frankly, you know, it's not one or two people, it's the vast majority that we're talking to are passing on these sorts of messages. But with that, I'll give Colin a second in case there were any more super chats or anything like that. I'm happy to take them. Or John, if you see anything in the comments that seem notable. Again, this sort of stuff is important. Even just getting the messages out of these residents and these health effects that are happening, like this is tough stuff to talk about. I honestly, talking to a lot of these people, I was tearing up in interviews yesterday and almost today because the situation that these people are in is so dire. Their homes are worth nothing at this point. Who's going to buy a house here? A lot of them are already in tough financial situations. They're having to deal with health effects. They're worried about their kids walking to school. It's insane. On top of it, we're trying to break some bigger stories here as well. That is only possible with your support. I can't stress that enough. Like I said earlier, this is a huge story. We're going to be back here again and again and again. Jordan spent 8 years and is still spending time covering Flint, Michigan. This is a similar type of deal, right? I'm going to be back here over and over again to make this happen. And this stuff is not easy to do. It's expensive to do. Again, I wish that John and I could come here and do this for free, but we also have bills to pay. So we got to take care of that. We got to pay for hotels, rental cars, all sorts of things like that. The stuff adds up. If you can become a member for just $5 to $10 a month, the cost of a cup of coffee per month, it's nothing. Less than your Netflix subscription, and we put out, you know, tons of stuff every day, right? If you can chip in and make that happen, please do. StatusCoup.com/join. Let me just double check here to make sure we didn't get any more. We got a couple more. Alrighty, here we go. We got that. Here's Jordan's super chat. Colin got you in this one, Jordan. So Louis DeAngelis is doing God's work. Help keep him on the ground by becoming a Status Coup member for $5 to $10 a month. You heard it again. There you go. You can't say it enough. So we'll get it out there again. And then to hit the point even more, we had a second one. What else do you spend $5 to $10 a month on that you don't need? Please direct those dollars to real on the ground journalism. And then we had another one from D Nord, $5. Thank you with a heart. Thank you, D. That means a lot. We, again, really appreciate it. Coming next, we're going to have all sorts of stuff coming up. So please be subscribed. Again, interviews with residents. We're going to have interviews with folks from in front of the Assistance Center who are waiting. Over the next couple of days, it's going to be pretty interesting, too. Tomorrow night, we've got President Trump coming into town. We'll definitely go live for at least a portion of that. We'll see if we can go live right through the event in the main room. If not, we'll definitely be live before and after, talking to residents and seeing what they have to say about this. This is definitely a popular terrain for him, but we've heard from residents that they see it as a photo op to come in. What is he going to do? We will see what happens there. Again, we're working on stories potentially involving the companies dealing with some of the air tests here, and we actually have paperwork from lots of residents. We're trying to piece the puzzle together here to try to break potentially a story on all of that. The more time we're able to spend here and actually talk with these residents, and the more times we're going to be able to come back in the future, are what is going to be able to make all of that possible. So with that being said, thank you all so much for watching. If you're not subscribed already, please do. That's what I just did. Yep. Yeah, we're good. Thank you all. No, you're good. Thanks all so much for watching, and have a great night. Whew.